So, Rebecca, I just want to make sure that I have everything to completely understand what's going on with your situation so that I can better help assess you. So, currently you're 34 weeks pregnant, is that correct? With your third child, which is very exciting. I've got two little young kids, which I'm sure your hands are full with. But reason for you coming in though is you've been experiencing some back pain, low back pain, which this is something that you've never experienced before, correct? Especially too with your previous pregnancies, right? And is currently getting worse. There was nothing that came about as far as injury or anything that you suspect. Said that you expect this to be from the pregnancy. Currently what you're doing, you've been using rest, heat, and some stretching to help with that, but it's only temporary. And also as well, you've been told by your massage therapist as well as your OB doctor who you've been consulting with that they said just take some time off and some rest as well. You said that a lot of bending forward, lifting, carrying, walking and sitting for periods of time does not help the pain that you're currently experiencing, and that a lot of your current activities involve your children, which is a lot of the bending and lifting and carrying of those small children. And you've never had any surgeries or anything like that. Never had both those previous pregnancies were natural, and that you've just been worried about the increasing intensity of the pain that you're experiencing, and that you're 34 weeks pregnant. So I do understand everything that's going on. Completely understand, hear you out. And I do think, based off of the exam results finding, and also knowing that your trunk range of motions in all ranges or in all directions, lying on your back as well as rolling to your right, that they also produce some pain. But based off, like I said, your exam results, thinking that what we have going on currently is something that's called sacroiliitis, which is very common in pregnant women. So nothing to be worried about, because this is actually something that is natural for the body and that can be expected when the body is going through these changes and preparing for the birthing process. And so this is something that can be very common and very typical, but it's nothing to worry about, as I said before, because this is something that I believe that chiropractic care can actually help you with, without going through the invasive steps that could come about this later on, if we didn't take care of it first. So what I recommend, I know that a lot of this can be overwhelming to you right now, just again because you're pregnant. And I see that your husband, he works a lot of night shift, and so you're stuck with your other two children by yourself. So I know a lot of this can be overwhelming for you right now, but I really think that we can help. One of which I think that I recommend first off is chiropractic care. Chiropractic care, specifically what's called Webster technique. This technique can actually be deployed not only for pregnant women, which is very popular among pregnant women, because what it has to do with is the sacrum, and the sacrum is the keystone to the rest of the spinal column. So with that being said, a lot of people that have sacral issues, men included, this is a very popular technique. So I really think that this technique, what we can do with that technique is we can get you some relief, so that way you can continue with your pregnancy as planned and with the least amount of stress as possible. That way you can keep up currently with your daily regimen as well as your children. So next recommendation I have are a couple exercises. Being side bridges as well as the glute bridge. We can do those here, or I can send those home with you. But what I could do real quick is to show you those. So if you'll give me just a moment. So, first off, first off, for a side bridge, what we want to do is we want to make sure we're going to lift off the side of the floor here, and we're going to really engage these side muscles as well as these side muscles here on your hip. So what we're going to do is we're going to stabilize here up at the top with your forearm on the ground and your upper arm. We're going to lift with our hips using our knees first. Using our knees first, and we're going to hold that for a period of time. What I would like to recommend would be anywhere between 3 to 4 sets of just 15 seconds, just starting out. If that's too much for you, we'll just bump that down to 10 seconds. You know, and then we'll increase those as well. Specifically your right side, since the right side, as far as the exam results that we came up with, since it was right-sided, we really want to focus in on that right side. The next one is the glute bridge. So what we're going to do is we're going to lay flat on the floor with our knees up, hands to your side, and what I want you to do is I want you, as the exercise states, is to bridge, activating your bottom muscles here, and we're going to hold that for a period of time. We want to make sure that we're engaging that posterior chain of muscles there. All of that being said, with these exercises, what I would like is to really focus on some muscle groups that could be weak currently, because with the pregnancy, a lot of things are changing throughout your body, as I've already stated and as you already know as well. But a lot of these can actually be some relaxed muscle groups. So what we want to do is we want to strengthen those relaxed or stretched muscle groups. That way, whenever we go in with the chiropractic adjustment, that way it holds the adjustment longer, and also it strengthens those muscles. That way, any of those muscles that could potentially be contributing to your pain, we have those corrected as well. But there are other many things though with care that if you'd like to talk about, as far as like decreasing your stress, exercise or anything of that nature. Breathing exercises are really beneficial. We could definitely set something up for you as well. But those are all the recommendations that I have for you right now. There's nothing as far as your current situation that I think needs to be really looked at in regards to a very severe, very stressful kind of in any of that kind of way. But either way, I believe that this is something that we can correct, and as well as, you know, afterwards with the birthing process, I believe that this is something that we could continue on for a period of time and continue to increase your health. So, thanks.